Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erika Mayall, and today we're going to talk all about tendonitis in dance or in dancers, and why maybe that term, tendonitis, is not potentially the most correct term. We're going to talk about the difference between a tendonitis and a tendinopathy and other types of tendon injuries that we see. So I've talked a little bit about tendons and tendinitises in a previous episode that was more about classifying different types of injuries, how we actually categorize and classify injuries. So strains and sprains and itises, so bursitis, tendonitis, all of those types of things. So if you're curious more about that, I would suggest going back and having a listen to that podcast episode. Today, we're going to dig into specifically tendon injuries in dancers, what they are, why dancers are susceptible when we see them, what types of tendon injuries we see most commonly. And this is a fairly timely episode right now because it is the beginning of a new dance season, at least here in North America. This podcast is going to drop kind of just around the beginning of October. I'm not sure exactly which date yet, but towards the beginning of the dance season. And this is the part of the season or a time in the season where we tend to see a big uptick in tendon injuries. And there is a reason for that. And we'll get into that as we go through this podcast episode. But I want to dive into some of the basics first before we kind of get into the specifics of why it is that we see more tendon injuries around this time of the year. So in order for us to understand what a tendonitis is or what tendon injuries are, we need to understand a little bit about what a tendon is. And so a tendon is the structure that attaches our muscles to our bones. And so it's sort of we have our big meaty part of our muscle belly, and then those blend into what we then call the tendon. And that is actually how muscles attach to bones, is through this tendon structure. And so tendons really are continuous with muscles, but they're different than muscular tissue. So muscles are what we call contractile tissue. So they contract and relax, and that's how muscles exert force. But tendons are non-contractile tissues, and they have a higher proportion of collagen fibers. So it makes tendon tissues really quite strong and quite robust with this sort of non-contractile structure and this high collagen fiber content. They can stretch to some degree, but they don't stretch the same as muscles do. So muscles are often what we call like really elastic, like we think of them almost like a rubber band, like they stretch and then they contract back down. But tendons don't stretch and contract the same way that muscle fibers do. So they're much, much less elastic and they're non-contractile. And because they're less elastic, they're less flexible than muscles are. And there's a really good reason for this. Tendons are, like I said, the attachment point of how muscles attach to bones, but they're also our big sort of force transmitting structure. And so that's actually how we exert forces. So the force of that muscle contracting can then exert force on a body part and actually move our body part is through the action of those tendons. And so our tendons need to be really, really strong. So they're much stronger than other structures in our body potentially, and that's for that force transmission. One of their other big roles, is that force transmission, so from muscles into bones or joints or whatever you want to call it, to actually have actions occur in the body. But another big role that they play, another job that they have, is that they are really involved in shock absorption. And so again, it's sort of that transmission of force from one area of the body to the other. So between muscles and bones and between bones and muscles. So we can think of that as force production. And then we also think of that as force absorption or like shock absorption. So tendons are really important in that sort of property of shock absorption. And because of that, they assist in what's called the elastic recoil. And so tendons are able to stretch, like I said, to some degree. So if we're, say, landing from a jump, there's going to be a bit of a stretch response that happens in a tendon. And whether that's the Achilles tendon in the ankle or the patellar tendon in the knee, we get the stretch response that happens in these tendons. And then we get what's called elastic recoil. And so if any of you took, high school physics and stuff, you'll understand some of these properties. But we get this elastic recoil that happens in our tendons, and that allows force transmission. So in the example of, landing from a jump, we then want that elastic recoil to be able to take off from a jump again, like a subsequent jump. So again, that can be happening in any of the tendons that are involved in that action. So these are some really important properties to understand about tendons and sort of their job and their role in the body, because when we start to talk about what goes wrong when we have tendon injuries, these properties are important things to remember. So hopefully that makes sense to you and you can kind of have a visual in your mind in terms of what a tendon does, what its structure is, and kind of a little bit of the role that it plays or how it works. So in our body, when we stress any of our tissues, and so that can be our muscle tissue, it can be our bone tissue, it can be our tendon tissue, it can be ligament tissue, it can be any tissue in our body. But when we stress our tissues in our bodies, there's a certain amount of micro damage that happens. And it's usually at a really low level. And then the repair of that micro damage that happens is how we get training effects. So if we think about muscles for a second, and we're trying to get stronger with muscles. So say we're doing some strength training, some weight training to gain strength in our muscles, we will load those tissues. So we'll say we're lifting weights and we're going to get these minor amounts of micro damage that are happening in the muscles. And as the body repairs itself and recovers from that micro damage, those tissue adaptations are what leads to increased strength in that muscle over time. And so this same process happens in all of the tissues in our body. So in our tendons, if we're loading or stressing those tendons, we get this micro damage that happens, and then our body should be able to repair that damage. And ideally, our body should be able to repair that damage before our next training session. And so that is what we call recovery. And I've done a podcast episode specifically about recovery, and we've talked about this a little bit, and I'll link that podcast in the show notes if you're interested more about what is recovery, why recovery matters, how we optimize recovery, all of those types of things. But in this process of how tendons specifically are adapting to things, that recovery process is really, really important. And so, like I said, we load our tendon, we have tiny bits of micro damage that happen, and ideally our body is able to repair that, and then we go and we train again the next day or 2 days later or whenever it is. However, what often happens, or what can happen, is that when the loading that we're exerting on these tendons, if that loading exceeds the body's ability to repair that micro damage, we're going to end up with accumulated damage over time. So if we're loading at higher rates, and so therefore that is happening faster than our body is able to repair the tissue, we get tissue breakdown that happens. And then we can begin to experience pain or problems in that area. And so this is commonly the mechanism of what we see when we talk about tendon injuries, or if we're experiencing pain and issues in tendons, is we just start to get a little bit of this imbalance happening where the loading that's happening is happening at too high of a load or at too fast of a rate, and the body can't keep up from a repair perspective. And we eventually get this like low grade or slow grade tissue breakdown happening. This is the exact reason why we see an increase in tendon injuries in the beginning of dance seasons. And it's not the only time in the dance season that we see increases in tendon injuries. We see it anytime loading levels change suddenly. And so tendons, if you remember back to sort of what their job is and what their structure is, they respond to loading. Tendons respond more so probably than any other tissue in the body. They respond to loading. And if we are changing that loading too quickly, we're going to get that tissue breakdown happening. And this happens really commonly at the beginning of a dance season. So if we've had people who have had an off season, and so ideally in a dance world, and you've heard me talk about this endlessly now at this point, if dancers have had an off season and they're coming back in, their tendons are probably not used to loading to the same degree. And so we need to slowly, gradually build up the loading in order for the tendons to be able to go through that process of micro damage and then repair. And that's going to happen kind of cyclically as the tendons build up their tolerance to that loading. But in reality, what we often see is dancers go from having a bit of a break, a summer break, to all of a sudden loading their tissues fairly suddenly, in the sense that they're going back to training a lot of hours all at once. And so that's, again, one of the reasons why having a proper preseason and really gradually ramping back up into a dance season is so important. It's for the tissues to be able to gradually adapt to those increasing loads, and specifically tendon tissues. So in the clinic, we just start to see patterns of things. Like, I've been doing this for enough years that you see these patterns. And always, I would say the maybe more like fourth week of September and into the first 2 or 3 weeks of October, most of the injuries coming through the door, people who are having aches and pains and things like that, are tendon loading issues. And it's people who have ramped back up really suddenly in September, and by the third, fourth, fifth week of their training, those tendons are starting to have that micro breakdown that's happening, and they're starting to develop pain in those tissues. So we really commonly see tendon injuries at the beginning of the year because they haven't been able to adapt to those changes in loading quickly enough. And we can't change how quickly those tendons adapt to loading. It would be awesome if we could just be like, oh, let's make our tendons be able to adapt to these loads within a week's time. But unfortunately, that's not the way the body works. And tendons often need at least a 6-week kind of runway to build up to those increases in load. And that is why we recommend the length that we do for a preseason or for a gradual return to dance when we're talking about training intensities and training loads, because we unfortunately can't change how those tendons or how those tissues are responding to injuries. If we could figure that out, we would be, I wouldn't be doing this anymore. I'd be off on a private island somewhere doing something and would have made a lot of money off of it. But unfortunately, that's not how the body works. So we need to respect that physiologically, that is how tendons respond to load, and they need that time to adapt to that load or they will break down. So what happens if they start to break down? Well, we can have different types of tendon injuries that happen. And so most commonly, these will be called a tendonitis. So itis, that ending of the word we've talked about on a previous podcast, usually indicates or signals inflammation in an area. And in this case, the tendonitis, it would be inflammation in the tendon. And over time and more recently, they've been doing more research into tendon injuries, and they've discovered that more often than not, there's actually not acute inflammation associated with tendon injuries. And so the terminology that is more correct, most likely, and that is more commonly used nowadays is actually like an OSIS, so tendinosis, as opposed to itis, because that reflects that there's maybe not inflammation. So that's just dysfunction in the tendon, or you'll commonly heard it referred to as a tendinopathy. And so tendinopathy is probably the more accurate terminology, and that just means there's pathology or there's like a disease within the tendon. And so, it's not a disease, but it's dysfunction or pathology that is happening within the tendon. So we tend to try and use the more correct terminology, so a tendinosis or a tendinopathy, but you will really, 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 really commonly still hear this referred to as a tendonitis. And if you're seeking out medical attention, depending on who you're getting an assessment from or where you're seeking out medical attention, you may still get a diagnosis of a tendonitis because it's such a familiar term to lay people that some medical professionals are still using it, just so that people understand kind of what's going on, but realize that it's maybe not the most correct diagnosis. So that's not to say that tendinitises don't exist, because they absolutely do. And we do still see tendinitis where there is inflammation present, but this is almost always seen only in an acute injury. So something that happens all of a sudden and somebody injures their tendon acutely, then it is most likely a tendinitis, and there's probably some inflammation that is an active inflammatory process, and we would call that a tendinitis. That is usually only going to last for a short period of time. And if we have pain that persists beyond that acute inflammatory phase, then the correct terminology would be the tendinosis or the tendinopathy. And in the dance world, we actually don't see a huge amount of acute tendon injuries, or at least I don't in my practice. Most commonly what I see are these tendinopathy injuries, and those are a result of what we were just talking about previously, this like loading responses where we get this micro damage that the body just cannot adapt to, and you get this slow breakdown that happens over time. That generally does not have an active inflammatory process associated with it. So it would be termed a tendinopathy and not a tendinitis. So tendinopathies, or tendinosis, if you want to call it that, are generally more chronic type injuries, and they are perpetuated by or exacerbated by loading, so mechanical loading like we just talked about. And they happen, or the degeneration that happens, or the breakdown in the tissue that happens, is happening at the level of the collagen that forms in the tendons. And I don't want to get super, super technical about this, but a lot of the more recent research that's being done into tendon injuries and to tendinopathy is looking at what is it that's actually happening at a structural level when we have an injury to a tendon, because it behaves differently than what we used to think. We used to think that there was this active inflammatory process. Now we know that there isn't. We know that the breakdown is happening at this collagen level, and we get this microvascularization that happens, and all of these like physiological processes that are happening at a tissue level that I'm not going to dive into super deeply on here. But because of those changes that we see at a physiological level, that is what makes tendon injuries a little bit of a pain to deal with sometimes. Anybody who's experienced any sort of a tendon injury knows that they're slow to respond and often can be a little bit more of a long-term injury. And it is because of those properties of what is actually changing at sort of this tissue level when we have these injuries that are occurring. We also, tendon tissues generally don't have great blood supply, and so that is one of the things that impacts like the rate of healing of tendon injuries as well. So that is the difference between a tendinitis and a tendinopathy. If you've heard both of those terms and you weren't sure if they were the same thing or not the same thing, that is sort of the difference between those. So those are the most common injuries that we see to tendons, and that's probably the most common diagnosis that a dancer is going to get, is a tendinitis type diagnosis. But we also have other types of injuries that can occur to tendons as well. So we can have what's called a tenosynovitis, and so every tendon is covered in a sheath, like a covering called a synovial sheath, and we can get inflammation of those synovial sheaths, and so we would deem that a tenosynovitis. And we see that sometimes in dancers, especially with some of the tendons around the foot and the ankle, where we can get like a tenosynovitis in those tendons around the foot and the ankle. They can happen elsewhere as well, but those are the most common ones we see in dance. We can also have partial or full thickness tears of our tendons. And so similarly to muscle or ligament injuries, where we can have partial and full thickness tears of muscles or ligaments, we can have those as of tendons as well. So if we think of a tendon a little bit like a rope, and I think I've used this analogy before on the podcast episode where we talked about classifying injuries. If we think about a tendon being a little bit like a rope structure, let's say, if we have a partial thickness tear, what we have happening is almost like a fraying of the rope. So, there's fibers of the rope that are torn, but the rope is still intact. It can still function. The tendon can still transmit force, but it's certainly not going to do it as efficiently, and it is probably not going to do it without pain in the case of a tendon. So if we think about a rope, sort of with like a fray, like a friction point in the middle of it where some of the fibers have started to fray, that would be similar to a partial thickness tear. And then a full thickness tear is exactly what it sounds like it would be. It is a full thickness tear where we would actually have like a rupture of that tendon. And the most common one that you'll hear about is an Achilles tendon tear. So people will oftentimes go to take off for a jump or something like that, and they might rupture the entire tendon in through there. A lot of these more acute tendon issues, I was saying we don't see as many acute tendon injuries in dance as potentially in other sports, but when we do see acute tendon injuries, they're often what we deem to be an acute on chronic. So somebody has maybe had a chronic issue going on in the background that they may or may not have been aware of. So they may have pain associated with it, so maybe they do know that they've had a bit of a tendinopathy going on. There's maybe a bit of a chronic tissue breakdown happening where the tissue's not functioning as well as it should be. And then there's an acute incident that happens where they then have an acute injury where it's maybe a partial thickness tear or a full thickness tear or something like that. So we call those acute on chronic injuries because we just know the tendon was probably not as healthy as it should have been originally, and then that acute incident where, taking off for a jump or something is enough that it just causes a more acute or more serious injury on top of that chronic injury that's maybe been going on in the background. Common causes of tendon issues, we've kind of touched on this a tiny bit, but sudden or dramatic changes in loading are probably the most common cause in the dance world that we see for tendon issues. And so we see these increases of loading that happen, like I've talked about at the start of a season, but we also see these happen when people are ramping up for a super busy time of the season. And so the one that's in my mind right now, because it's sort of starting to approach, is Nutcracker. And so as people really ramp up their rehearsals and then maybe do 35 shows of Nutcracker in the month of December or whatever it is, we see these spikes in training loads, and oftentimes the load exceeds the body's ability to recover. And so we get this tissue breakdown that's happening over time. So the most common cause of tendinopathy in a dance population is probably training load, the training loads exceeding the body's ability to recover, I guess is the easiest way of putting that. We can see tendon injuries that are associated with things like dance floors, like the surfaces dancers are dancing on or the footwear that they're dancing in. We talked about how tendons are the major sort of force transmitter / shock absorber. And so if we're dancing on, say, concrete floors or something that is not an ideal dance floor surface, or even just studios that aren't sprung, we are more likely to see changes in tendons or have the tendons sort of present as a problem with things like that. Increasing age is also a risk factor for tendon injuries. And so we do see more tendon issues in older dancers than we do in younger dancers. So we don't see them as commonly in, say, an adolescent dancer. We do still see them occasionally. We don't see them as commonly as we may in older dancers. And so again, especially for our professional dancers, things like recovery and having a preseason and gradually building up loading and things like that become more important because it does take the tendon slightly longer to adapt in those populations. You're just slightly more susceptible to tendon injuries in an older age group. And then one of the other big causes that we see is weaknesses in other areas of the body. And so if we have muscle groups that aren't as strong as they should be, we're going to end up overloading the tendons in somewhere else in the body. And so one of the things that we always look at when we're looking at tendon injuries or tendon loading problems, if we have a tendinopathy, is how is the rest of the body functioning and what does the dancer look like above and below that area? Because it's quite common, just for example, if we have a dancer who's having issues with their Achilles tendon, it's not uncommon that we might find weakness somewhere else in their body. And one of the most common areas that we'll often find it is their hip. And it might be the hip on the same side, but it is often the hip on the other side that might be weak and that then is overloading one particular tendon. So we always want to make sure we're doing sort of a full body assessment if a dancer is coming in with a tendon issue, because if we're not looking at what's happening, we might be missing what the cause of that tissue breakdown is. Because if we have a dancer coming in with a tendinopathy, we know that it is a loading issue. And if their schedule hasn't changed dramatically and they're not dancing on a new floor surface and there aren't things like that that kind of point to, okay, that might be the problem, we definitely want to look at what's going on in their body, because there's probably something that is causing that tendon to be overloaded. This is especially true if we have bilateral tendon issues. It's not as common to see bilateral issues. Like, you don't often get somebody who comes in and saying, both of my Achilles are hurting at the same time, or things like that. But if that is happening, if you have a dancer who's having issues on both sides at the same time, there is almost certainly, I will guarantee you, there is something going on somewhere else in the body, and it's usually further up the chain. So if it's a lower extremity issue, it's usually sort of further up. So maybe it's the hips, maybe it's the back, who knows? But there is almost certainly something going on that is causing the dancer to alter the way that they're loading those tendons, which is causing issues on both sides. Because otherwise, we typically do not see bilateral tendon issues if it is a more isolated issue in through there. The most common, I've kind of alluded to some of them as we've gone through, but the most common tendons that we see tendinopathies in dancers, and these are in no particular order, but it'll be no surprise to any of you that we see them most commonly in the lower extremity. So quite a few of the tendons in the foot and ankle are ones that we may see presenting in dancers. Achilles tendinopathy, very common in dancers, and I would say a lot of the times, especially in older dancers, and I'm not talking, dancers in their 40s even, I just mean dancers who are maybe 18 plus, like that kind of age group. We see them less commonly in younger dancers, but I would say younger dancers are often misdiagnosed with an Achilles tendonitis when in fact it's maybe more likely to be a posterior ankle impingement issue. So if you're starting to see a lot of, or you're like suspecting an Achilles tendonitis in, a 10, 11, 12-year-old dancer, it may be that, but I also would have a high suspicion of posterior ankle impingement because, like I said, we see tendon issues traditionally in a little bit of an older age population. That is not to say we can't see them in younger dancers, but sometimes it might be something else. So Achilles is a really common one. The other two in the feet that we see really commonly, one is the flexor hallucis longus tendon. So that is the tendon that comes kind of along the bottom of your foot into your big toe. This is actually often known as dancer's tendonitis. That's kind of, if you Google dancer's tendonitis, this is what will show up, because this tendinopathy is so common in the dance population, but relatively uncommon in other populations. So this is, like I said, the tendon that goes into the big toe. So it's really influential when we're dancing on demi-point or on point, or spending lots of time on a high releve and things like that, which obviously the general population or other sporting populations don't spend as much time doing. So we don't see it as much in other populations, but in the dancer population, it is a common one that we see. We also commonly see tibialis posterior tendinopathy. And so again, that is a tendon that comes sort of, the muscle belly itself is in the lower leg, and then the tendon comes sort of on the inside of the ankle. It swings behind your ankle bone, behind your medial malleolus, and then attaches to the inner arch area. It attaches into the medial arch there. And it's really important for supporting our medial or inner arch. And it's a really important tendon involved in sort of shock absorption and the normal functioning of our foot and our ability for our foot to absorb shock as it goes into a pronated position. And so that is one that we see just with a lot of impact with dance, with jumping, that we'll see tibialis posterior tendon issues. We also, if we're going to move up the chain, so moving from foot and ankle, patellar tendon, so the tendon that attaches our kneecap to the front of our lower leg, to the front of our tibia. That is one that we see commonly. Sometimes people call that the patellar ligament. It is a little bit unique because the patella is a floating bone. So it's what's called a sesamoid bone, but it floats and it's embedded in that tendon. The part that attaches into the tibia actually attaches to the inferior pole of your kneecap. And so that is actually technically attaching bone to bone. So we would actually deem that more of a ligament, but it is continuous with the quadricep muscle. And so it's a little bit of a unique situation. So it is still most often, I would say, called the patellar tendon, but sometimes it behaves maybe slightly more ligamentously. And then if we move our way up to the hip, the other common ones that we see in dancer populations in the hip are the front of the hip, the anterior hip, the psoas tendon. We will often see a tendinopathy in the psoas tendon in dancers. And then on the back side of the hip, the gluteus medius, or sometimes it's gluteus minimus, but I would say gluteus medius, or some of the deep hip rotators. So people often have kind of like posterior lateral hip pain where those tendons attach into it's called the greater trochanter, but it's the bony part of the outside of your hip. So across the back of the hip, sort of in those glute / turnout muscle areas, can be a common area of tendinopathy as well. That's not to say we can't have tendinopathies in any other tendon in the body, but those are just the ones that we see, or I see most commonly in the clinic. And definitely the foot and ankle and then patellar tendon are probably the ones that I see the most commonly, not so much the hip, although we see that as well. So what do we do if we have a tendinopathy or a tendonitis potentially as well? The biggest thing in terms of treating tendinopathies is load modification or activity modification. And that does not mean that we just stop all activity. And this is probably like the number one poor piece of advice that a lot of dancers are given by medical professionals who maybe do not understand dancers, or potentially don't even understand sort of how tendons work and how tendons respond to loading. Because if we completely unload a tendon, it may feel better temporarily, but as soon as we start to load it again, even if that's not like going back to dance loading, even if that's just returning to regular normal activity loading, I guarantee you that tendon is going to flare up again. Because if we remember that tendons respond to loading and they need time to adapt to those changes that are happening, if we completely remove that loading, we actually will potentially make that tendon worse. So when we talk about activity modification, we really want to maintain as high an activity level as we can relative to that tissue's reactivity. And what I mean by that is we don't want to be making the tendon worse as we're modifying activity, but we also want to try not to completely remove load from that tendon, because it just means that the overall healing process is going to be much, much longer. So we look at certain things like the tissue's reactivity. So how easily does that tissue get irritated, and how long does it take to calm down? So maybe we have an Achilles issue that is not super irritated. So it only starts to get sore at the end of maybe your 4th hour of dancing in a day. And at the end of that, it's pretty sore and, kind of bothering you or whatever, but you go to bed and the next morning and you wake up and it feels fine again. We would call that low reactivity in a tissue. So it takes quite a while for it to flare up, like 4 hours. 4 hours of dancing is quite a lot, and it's not staying flared up for long periods of time afterwards. And conversely, we could have somebody else who within 10 minutes of class, it's already really, really painful, and it stays painful for 48 hours afterwards. That would be a highly reactive tissue, and we're going to treat those very differently. So one of our a few of our kind of like rules of thumb that we'll use, and this is like the advice I will give dancers in the clinic, because inevitably one of the questions is, can I keep dancing? And the answer is often yes, because we want to keep a certain amount of loading within those tendons. But we want to make sure that we're not having pain that flares up and stays flared up for long periods of time. The sort of general rule is 24 hours, but I actually think that that's a little bit long in terms of if we're looking at dancers who are dancing sort of daily. I will tell dancers, because dancers are usually dancing into the evening. So it's like, if it's sore when you finish that day of dance, and maybe it's still sore when you get home that evening, but when you wake up the next morning, if it feels okay again, that is an acceptable level of reactivity in terms of how long it's staying sore for. We also can use sort of a little bit of a visual analog scale, or like a pain rating scale. So if we're thinking about a pain scale of 0 to 10, and 0 being no pain and 10's, worst pain imaginable, we don't want those numbers spiking a lot on that pain scale. So if a dancer goes in and maybe they have 1 out of 10 pain, it's just a little bit, feels a bit tight, a bit uncomfortable, and then they start dancing and it goes up to a 6 or a 7 out of 10, that is too much of an increase for us to be comfortable with. We want any increase in symptoms that a dancer might feel to stay within about 2 numbers on that scale. We also ideally want their pain to stay below a 5 out of 10. So if a dancer starts their day and it's a 1 out of 10, and by the end of the day it's gone up to a 3, I'm fine with that. And especially if, they then go to bed, they wake up the next morning and it's back down to a 1, that is a level of reactivity and sort of like pain within the tissue that we are comfortable with, and we can work with that in terms of then loading the tissue appropriately going forward. We then may need to adjust that depending on the reactivity of the tissue. So that is one of the things we look at in terms of maintaining as much loading as we can, but within the tissue's reactivity kind of parameters. And then we also may look at specific activity modification. So in the case of, let's say a patellar tendon issue, they often don't love jumping because they're so involved in like the shock absorption on landing and things like that. So we may limit how much jumping they're doing, but they may have no other limits in class. They may be able to do everything else, but we might say no jumping at all, or we might put limits on how much jumping they're allowed to do. You can do 32 landings in a day, or whatever it is. I'm just making up numbers at this point. So we want to modify the activity to an acceptable level of kind of tissue reactivity. And then we need to look at gradually increasing the loading tolerance of these tissues. And I know that sometimes it seems counterproductive or counterintuitive to people, where you think, okay, this tissue's already irritated. Don't I need to rest it? Don't I need to just, take a few weeks off, just not use it, just completely rest it? But if you remember back to how we talked about tendons' roles and their structure, we actually need to be progressively loading this tendon in order for the tendon to be healthy and to function properly. And along with that, we need to really prioritize rest and recovery. So when we're gradually increasing this tendon loading tolerance, we need to be intentional about how we build recovery into that as well. So we can use different tendon loading mechanisms. So oftentimes we'll start with isometrics. So we're not actually moving through movement, or just contracting and having load going through that tendon, but in a static or like a still position. We might use low load, high volume. So it's exactly what it sounds like. You have relatively little load, but you're doing high repetitions of something. We will sometimes use that for tendon loading tolerance. Or some of the more recent research is actually showing heavy, slow resistance to be one of the things that is really, really beneficial. So rather than doing a lot of repetitions of something, we might really load somebody from like a weight perspective. So we might give them, dumbbells or something, and have them be doing slow, controlled squats, but really low repetitions of them as a way of exposing the tendon to load, but being able to gradually build that up over time. So like I said, there's different ways that we're going to do this, and it really is super individual. So this is where you would want to be working with a healthcare provider who's knowledgeable in tendon loading and how we're going to progress that loading. As with all injuries, we also need to address any imbalances that are happening above or below the area of concern. And I talked about that a little bit already, that we want to look for weaknesses especially, but it can be other imbalances, but especially weaknesses that might be causing that tendon to be overloaded. We need to make sure that we are addressing those, or we're not going to have the results that we want with the tendon in question. And then we potentially may need to look at things like modifying footwear or flooring or things like that if we think that there's external factors that have contributed to this tendon issue. So sometimes that's like temporarily modifying what footwear a dancer is dancing in for them to have a little bit more shock absorption to help offset the tendons just a little bit. And then we can, progress them back to their regular footwear, or looking at flooring and things like that if that is possible. So those are just a few of the things that we consider from a physio perspective when we're dealing with tendon injuries or tendon issues in how we are sort of addressing them going forwards. There are obviously more medical interventions as well. So things like injections or, in like extreme circumstances, or if you had a full tendon tear, a full thickness tendon tear, then surgical options are definitely going to be on the table as well. So there's lots of other treatment options. But from a physio perspective, and when dancers come into my clinic and are dealing with these sort of tendinopathies that are related to load management issues, these are the biggest things that we're looking at from that perspective. So I'm going to wrap things up there. If you have any questions with regards to tendons, tendon loading, tendonitises, anything like that, please feel free to reach out. I'm always happy to interact with all of you guys. I hope you found that helpful, and I hope that cleared up a little bit of sort of confusion in not even just the dance world, but just in the world in general, between the difference between a tendonitis and a tendinopathy, and why they may actually be the same thing depending on who you're talking to and what it is they're talking about. So thank you so much for listening. I really appreciate your support, and I hope you have a great rest of your day.